If your blood sugar, glucose, is raised beyond the normal range, you are at increased risk of developing type 2 diabetes. It's called prediabetes, and it means you are also at risk of heart disease and cardiovascular disease, including having a stroke. It may sound worrying, but the good news is that it's at a stage when it can be reversed, and the most effective treatments are in your own hands. You could start today by doing more physical activity, eating a healthy, balanced diet, and losing weight if you're overweight. Every effort makes a difference and can dramatically reduce your risk of developing type 2 diabetes.
Between 1 and 3 out of every 4 people with prediabetes will develop diabetes within 10 years. People who have prediabetes are more likely to be overweight, especially around the middle. They may also have high blood pressure and raised cholesterol levels. The most commonly used test for prediabetes is the HbA1c blood test, which you can get simply and freely at your doctor's, pharmacy, or at an NHS health and wellbeing check. The HbA1c blood test shows your average blood sugar levels over a period of 3 months. A reading of 48 or above is diagnostic of diabetes. An HbA1c level between 42 and 47 indicates pre-diabetes.
Diabetes UK estimates that around 7 million people in the UK have pre-diabetes. Any or all of these increase your personal risk of having borderline diabetes. Having a close family member with diabetes, doing little physical activity. For women, having polycystic ovary syndrome or diabetes can develop during pregnancy, gestational diabetes. Coming from certain ethnic backgrounds, for example South Asian or African Caribbean, even if you're born in Britain.
There are usually no obvious symptoms with prediabetes. A raised blood sugar level is often discovered after you have blood tests for another reason. Sometimes, your doctor may suggest a screening blood test to check your blood glucose because they're worried about your weight, or you have high blood pressure, or high cholesterol levels, or if you have had a heart attack or stroke. But if you recognize you have risk factors, you can ask for a screening blood test yourself.
Diet is extremely important in preventing and managing diabetes. Here are some top tips. Focus on achieving a healthy body weight. Your doctor or nurse can check your BMI. If your BMI is high, you may need to lose 10% of your weight, which can delay the diagnosis of diabetes. To achieve a healthy body weight, you may need to reduce your starchy carbohydrate portions to 1/3 or 1/4 of your plate. For example, 2 small chapatis or a fist size of cooked rice or pasta, keeping to 1 type of carbohydrate at each mealtime. Using less oil can help you to lose weight. Oils have the same amount of calories and are high in fat, so always remember to measure oil with a spoon. Include a large variety of vegetables in your diet and no more than 3 hand-sized portions of fruit throughout the day. Be active daily. Increase your physical exercise on top of your normal daily activities, gradually building up to 30 minutes of exercise at one time, up to 5 times a week. This could be things such as brisk walking, cycling, swimming, or even dancing. And remember, these lifestyle changes must become part of a normal routine and should be long-term.
These changes can help reverse prediabetes, and there are other lifestyle changes that you can make to reduce your overall cardiovascular disease risk. These include stopping smoking if you're a smoker, sticking to the recommended alcohol intake, and finding ways to manage stress and practice relaxation regularly, such as yoga or meditation, or practicing mindfulness or relaxing to music or sound recordings. You may also need professional help for low mood, anxiety, or emotional eating patterns you may be experiencing. This is an important dimension to consider, as it can influence your physical health, including your blood pressure and cholesterol, as well as your appetite for life.
With support from your GP, the services that are out there, and a bit of willpower, you can really make a difference to your health.